Right, greetings to everyone and welcome to our today's discussion with me, Sunday Singalamba. Yes, so in our today's discussion, we'll discuss on leukemia. Yes, and the stem of the question is saying Sampa, aged 11 years, is brought to pediatric wing at a hospital with complaints of anemia and recurrent infections. A provisional diagnosis of leukemia has been made. So question A, it was saying classify the 4 types of leukemia. That was 30%. Question B, it is saying mention 5 clinical manifestations of leukemia. That was 15%. Yes, then for question C, it was saying describe the management of Sampa during his hospital stay. That was 40%. Then for the last question, it was saying outline 5 points that you would include in the information, education, and communication that you would give to Sampa's mother on discharge. Yes, so those are the questions that we need to cover at the end of our day's discussion. So before even start answering the questions, it is very important that we know what leukemia is. Yes, so for the definition of leukemia, I'm saying leukemia, basically it is just a malignant disease in which there is abnormal proliferation or production of immature white blood cells. Yes, so in leukemia there is excessive production of white blood cells that are immature. As a result, those white blood cells, they usually fail to fight against the invading organisms. As a result, the patient will have some recurrent infections, and also anemia will be present. Yes, we know to say there are 3 types of blood cells. We have the red blood cells that are used in the transportation of oxygen from the lungs to other body tissues. Yes, we also have the white blood cells. These ones they use in the fight against invading organisms. Yes, then for the last type, which is the platelets, these ones they are used in the process of blood clotting. Yes, so all these 3 types of cells, they are usually produced from from the bone marrow, basically from a primitive a cell known as a stem cell. Yes, so any alteration in the production of these 3 types of blood cells, it will bring in a condition known as leukemia. Yes, then question A, it was saying classify the 4 types of leukemia. Yes, so basically the classification of leukemia, it is mainly done by following 2 characteristics, of which the major characteristics are that as to whether that leukemia it is an acute form of leukemia or a chronic form of leukemia. Yes, then the other characteristic that they follow is as to whether it affects the myelocytic cells or the lymphocytic cells. Yes, so those are the major characteristics that they follow. So now what are the 4 types of leukemia? The first type of leukemia, it is acute myelogenous leukemia. Yes, so this one, it is a term known as it is a term known as acute myelocytic leukemia. Yes, so for this one, it is just an acute form of leukemia that affects the myelocytes. Yes. Then for the second type, it is chronic myelocytic leukemia. Yes, so for chronic myelocytic leukemia, basically this one, it is just a chronic form of leukemia that typically affects the myelocytic cells. Yes, so for the other name for chronic myelocytic leukemia, we can also call it chronic myeloblastic leukemia. Yes, then for the third classification that we could also talk about, we could talk of acute lymphocytic leukemia. Yes, so for acute lymphocytic leukemia, we could also call it We could also call it acute lymphoblastic leukemia. Yes, so basically this one, it is just an acute form of leukemia that typically affects the lymphocytic cells. Yes, then for the fourth type of classification, we could say chronic lymphocytic leukemia. Yes, so for the other name for this one also, it is what we call chronic lymphoblastic leukemia. Yes, so for this one, it is just a chronic form of leukemia that typically affects the lymphocytic cells, just like that. Yes, then question B, it was saying, mention 5 clinical manifestations of a leukemia. Yes, mention 5 clinical manifestations of leukemia. So the first clinical manifestation that we could mention could talk of headache. So headache, this one comes in as a result of what? Cerebral hypoxia. Yes. Then the other clinical manifestation that we could mention, we could talk about a bone pain. Yes. So bone pain, this one, it comes in as a result of what? Ischemia. Yes. Then the third clinical manifestation that we could mention, could talk about what? Fever. Yes. So fever, this one comes in as a result of what? An increase in the metabolic rate. So metabolic rate in leukemia, it usually tends to do what? To increase. Yes. Then other than those, we could talk about signs and symptoms such as splenomegaly. Yes, so the spleen may get what? May get enlarged. Yes, even hepatomegaly may also be present. Yes, so those are the 5 clinical manifestations that baby Sampa is likely to present with on admission. Yes. Then question C. Question C, it was saying, describe the management of Sampa during his hospital stay. Describe the management of Sampa during his hospital stay. So this question was asking us for the management. So meaning that we need to both write medical management and also nursing management. Yes. So for the medical management, remember to say under medical management there are 2 things that we need to talk about. We need to talk about investigation and also the treatment. Yes. So on investigations, certain investigations that could be done in this condition, we need to do history taking, we need to do physical examination, we need to collect bone marrow biopsy, we also need to collect lymph node biopsy. In addition to that, could talk about a chest X-ray, as this one, it will help us in ruling out pulmonary infections. Yes. Then finally, we could do full blood count, as this would show an elevation of white blood cells and also low platelet count. Yes. So those are the investigations that we can do in condition. Coming to the treatment. On the treatment, we need to give cytotoxic drugs. Remember, leukemia, it is a form of cancer, so we need to give somewhat cytotoxic drugs such as vincristine. Yes, so vincristine can be given in this condition in order to prevent that excessive proliferation of those white blood cells. Yes. Then the other drugs that we can give prednisolone. Remember, prednisolone, this one is just a steroid medication. Yes, so we can give prednisolone in this condition. Yes. Then the other drugs that we can give antibiotics. Remember, this patient has got a lowered immune system due to immature white blood cells that are being produced. So we need to give some antibiotics such as penicillins in order to fight against those invading organisms. Yes. Then for the nursing management, there's nothing to discuss about in this condition. The major thing that we need to ensure under the environment is the fact that this patient needs to be nursed in reverse barrier nursing, due to the fact that this patient is prone to some infection due to his or her lowered immune system. Yes, so this patient needs to be nursed in reverse barrier nursing. Yes. Then for the following headings, just need to follow the general nursing care that we usually write. Yes. Then for question D, it was saying outline 5 points that you would include in the information, education, communication that you would give to Sampa's mother on discharge. That was 15%. So for the ISA, we need to talk about drugs. So it is very important that this child is given the medications on time, because we know to say certain medication they gain resistance once we don't give them inconsistently. So it's very important that we give these medications on time. Yes, we also talk about what the review dates. It is very important that the mother brings baby Sampa to the hospital for some reassessments. Yes, so it is very important that the review dates are they are followed effectively. So we need to talk about nutrition as well. So on nutrition, it is very important that this child is given foods that are rich in vitamins in order to help in the boost of the immune system. Remember, this child has a lowered immune system, so this child is prone to infections. So we need to talk about that as well. Yes. The other thing that we need to talk about, a clean environment. Yes. So this child it needs to make sure that is nursed in a clean environment in order to prevent some infection that may invade as a result of our immune system. So we need to talk about all these things to the mother. Yes, so those are the 5 major points that we need to talk about under the information, education, and also communication. Yes, so on that note, we come to today's discussion. Yes, so don't forget to follow the page, and also don't forget to share. Yes, thank you for listening.